Hello everyone, this is Suprava. Welcome back to another session with me. In today's session, we will be discussing about hypospadias. So let us first understand what is the meaning of hypospadias. Now, if we divide the term hypospadias, we get two words, that is hypo and padias. Now, hypo means below and padias means opening. So that means in this condition, instead of having an opening at the tip of the urethra, there is opening at the bottom of the penile shaft. Now, as you can see in this picture that the opening of the urethra is not at the tip of the penis. Instead, there is the opening is present on the ventral surface of the penile shaft. So, moving on to the definition of hypospadias. Now, moving on to the definition of hypospadias. So, hypospadias is a congenital anomaly of the penis in which the urethral opening is situated on the ventral side of the shaft of the penis in one or several positions just behind the glans. So that means this opening is present on the ventral surface of the penile shaft, that as you can see in this picture, and also this opening can be present on the several positions. Now when we are saying that this opening can be present at several positions, that means there can be different types of hypospadias, right? So let us see what are the different types of hypospadias. So majorly we have three types of hypospadias, and the first one is granular. Now in this, as you can see in this picture, that the urethral opening is present at the just below the head of the penis. So here this is called granular hypospadias, and this is the least severe type of hypospadias. And then the next one is mid-shaft hypospadias. So here the urethral opening is present on the medial surface of the penis, that is on the ventral surface of the penis, and in that specifically the medial surface. So this is called mid-shaft hypospadias. And then the third one is pinoscrotal hypospadias. So here, as you can see, that the urethral opening is present at the surface where the penis and the scrotum is coming together. So this is called as pinoscrotal hypospadias. So from the name itself, you can remember that here the penis and the scrotum both are present. So that means it is present at a surface where both the part is coming together. Now this is the most severe type of hypospadias. So these were the types of hypospadias. Now moving to the etiology of hypospadias. So first, it is believed that the etiology of hypospadias is unknown. So it is idiopathic. Then it can be also arrested development in fetal life. So during the developmental process, when the penis is forming or when the urethra is forming, in that time, if there is no proper development, if there is arrested development in fetal life, that also might be a cause of hypospadias. Then if there is family history, that can also play a role in hypospadias, and also in case of gene mutation. And then at last, it can be also due to lack of hormone production during the fetal life. So you can understand that in most of the cases, the cause of hypospadias is unknown. And then other than that, in some cases, it is believed that there are certain factors which can contribute to the cause of hypospadias. That is, it can be if there is arrested development in fetal life, or if there is any family history, gene mutation, or also if there is lack of hormone production during the fetal life, that might contribute to the occurrence of hypospadias. Then moving on to the symptoms of hypospadias. So the first thing that we can say, the symptoms of hypospadias will be, there will be abnormal stream of urine. So you can understand that the opening of the urethra is not at normal location where it is supposed to be. So it is supposed to be at the tip of the penis, right? But it is not there. Instead, where it is present at the ventral surface of the penis. So that is why what will happen, there will be abnormal stream of urine. And then in later life, there might be sexual dysfunction, fertility problems. And also psychological problems may arise due to these things, because there will be sexual dysfunction, there will be fertility problems, and also the abnormal stream of urine. So these things might cause, psychological problems in a person. Now moving on to the assessment of hypospadias. So if a child comes with hypospadias, what are the assessment that we need to perform, or how we need to, how we would be able to understand that it is a case of hypospadias. So the first thing that you would notice is abnormal pattern of voiding urine. So because their urethral opening is not at the proper location, that's the reason their pattern of voiding will be, different in these children. You can also see that the stream of urine would be deflected downwards, because again the urethral opening is at the ventral surface. It's below, right? So that's the reason there will be the stream of the urine will deflect downward. And in case of penoscrotal hypospadias, you can see mostly the child will void in sitting position. And in case of glandular hypospadias, the child can void in standing position by tilting the head of the penis a little bit upward. So these are the patterns that you can find out in a child with hypospadias. So there will be a pattern of voiding, and all these characteristics that in case of certain hypospadias, the child will adopt certain position to void. So these things you can find out during the assessment. Now after assessment, the next thing will be management, right? So when we are talking about management, first we think of pharmacological management, and then our surgical management, right? But this condition is something which cannot be managed through pharmacological management. So there is basically no pharmacological management for this condition. And that means we only have the option of surgical management, right? So when we are doing surgical management, what will be our goal? So the first thing will be to bring the urethral opening at the tip of the penis. So that is the first major goal, because here the urethral opening is not at the proper location, and the proper location is at the tip of the penis. So our first goal would be to bring that opening from the ventral surface of the penis to the tip of the penis. And then the next thing would be to straighten the penis. So these are the two major goals that we have to consider when we are doing. Now here there are two things that I would like to tell you. That the first thing is that this surgery should be performed at the age of 6 to 24 months of age. And the second thing is, in these children, circumcision should be avoided. Now, why circumcision should be avoided? Because we know that in circumcision, the foreskin is removed, right? But this foreskin is the source of the tissue through which the surgeon uses this tissue to rebuild the missing part of the urethra. Now, there are several surgical procedures through which this condition is corrected. So, the first thing is orthoplasty, and then they do urethroplasty, and the third one is metoplasty or granuloplasty. Now, each of these procedure has its own goal. So, when we started talking about surgical management, I told you about goals, right? What is our goal for this surgical management? So, each of these procedure would perform its individual goal. Now, I also told you that one of the goals would be straightening the penis, right? So, we have to straighten the penis, and that is done through orthoplasty. And the next one is urethroplasty. So this is rebuilding of urethra so that the urine and the semen can flow as far as possible. And then the last one is metoplasty or granuloplasty. So through this, they build a new opening and they reconstruct the head of the penis so that it can accommodate the new opening that the surgeon is making. So this was all about surgical management. Now moving on to the nursing management of hypospadias. So while talking about nursing management, the first thing that we would focus on the nursing diagnosis. So the first nursing diagnosis that we can make for this children would be acute pain related to surgery. Then there will be also impaired urinary elimination related to trauma from surgery. And as there is change in environment, that can also cause anxiety to the child. Also, there are certain invasive procedures are being done, right? There is surgical incision. There's also catheter would be inserted. So for that, there would be risk for infection. Now we would see what are the pre-operative care and post-operative care that you should provide to a child with hypospadias. So basically in pre-operative care, you have to prepare the parents for the child's surgery. So preparing means you have to prepare them, emotionally, psychologically, right? So you have to educate them, you have to explain them about the process, how you're going to take care of the child, and you also have to provide psychological support to the parents. And then coming to post-operative care. So in post-operative care, the first thing that you should do, monitoring the vital signs. So if there is any changes in the vital signs, if there is any deviation in the vital signs, that would indicate if there is infection or if there is any sort of problems in the child, right? So you have to continuously monitor the vital signs. And then I also mentioned that there would be catheter inserted, right? So when there is catheter, you have to make sure that you provide proper catheter care. So that you have to do to prevent infection. And apart from catheter care, you also have to make sure that there is no presence of infection. So for that, you have to, do urine analysis. So that would help you to rule out if there is any infection. And then also when we have a pediatric patient, it is a challenge for us to make sure that the tubing which are attached to the child is properly secured, because they might pull out the catheter or the tubings attached to them. So you can use restraints in case of that. If you find that the child is trying to pull out the tubes or the catheters, so in that case you can use restraints. And apart from these things, you have to provide support and guidance to the parents that how to take care of the child. So this was about pre-operative care and post-operative care. Now, apart from these things, let us see what are some major, nursing intervention, or we can say nurse's role in taking care of a child with hypospadias. So if we have a patient who is suffering from hypospadias, in that case, we will have, certain goals to overcome. So the first thing would be relieving from pain. So definitely if the child is having pain, the parents are tend to panic. So in that case, you have to educate them that the medications you are giving to reduce the pain and also to reduce the restlessness. So about all these things, you have to educate the parents, and you can also use cold compress if it is indicated. The next thing would be improve urinary elimination. So once the catheter is removed, you have to encourage the child to drink more water, and also you have to educate the parents if there is any change in the pattern of voiding, and if there is any abnormalities that they find out, it is very important to notify the physician. And then the third one is lessen anxiety. So how you can do that? You have to allow the parents to ask their doubts, and you have to calmly answer them and clarify their doubts. Also, you have to reassure the parents that the surgical procedure will not compromise sexual and reproductive ability. And then the fourth one is prevent infection. So for preventing infection, what you can do is, again, you have to provide proper catheter care. You have to also do urine analysis to find out if there is any infection. And you also have to, educate the parents that any rough activities should be avoided till the physician clear the child for those activities. And apart from these things, you also have to make sure that whenever you are, changing the dressing, or you are providing catheter care, or you are draining the urine bag, you have to use sterile technique. So this was all about nursing management. Now moving on to the complications of hypospadias. So the first thing that can happen as a complication of hypospadias is bleeding or hematoma. Then there can be meatal stenosis. There can be also urethral stricture or urethral diverticulum. And wound infection might occur, or impaired healing, or also or with that there can be also breakdown of the repair. So these were the complications of hypospadias. Now let us conclude our today's topic. So today we learned about hypospadias, which means the urethral opening would be present at the ventral surface of the penis, and what are the problems that would occur due to this condition. We discussed about that. So I hope you have got a better insight about the topic. Thank you.